Welcome to AI TV News. The system that has kept American vaccines safe for 6 decades is facing its biggest upheaval yet. Health and Human Services Secretary Robert F. Kennedy Jr. has abruptly dismissed every member of the Advisory Committee on Immunization Practices, ACIP, an independent panel that sets the nation's vaccine schedule. Kennedy calls the move a clean sweep, aimed at rooting out conflicts of interest and restoring public confidence. According to CBS News, all 17 veteran scientists were told their services were no longer needed. In their place, Kennedy has installed 8 new members, the minimum the law allows. Several of them have publicly questioned vaccine safety or promoted unproven health theories. The reaction was immediate. More than 100 medical organizations, including the American Medical Association and the American Academy of Pediatrics, issued a joint statement condemning the purge. The AMA even passed an emergency resolution urging the Senate to investigate and to reinstate the ousted experts. Critics warn the shakeup could cripple a system that has quietly protected Americans from diseases like measles and polio. Senator Bill Cassidy, a Republican physician whose vote was pivotal to Kennedy's confirmation, says the secretary promised him he would not touch ACIP. In a tense hearing last week, Cassidy accused Kennedy of breaking that pledge and playing politics with public health. The concerns are practical as well as political. ACIP recommendations determine which vaccines insurers must cover and guide the federal Vaccines for Children program that serves roughly half of all U.S. kids. If doctors and insurers lose faith in their revamped committee, coverage decisions could splinter from state to state. Sensing that risk, medical societies and state health departments are exploring a fallback plan, creating an independent, non-governmental panel to issue their own vaccine guidelines. They would negotiate directly with manufacturers and ask insurers to follow their recommendations instead of Washington's. But such a parallel system faces steep legal and financial hurdles because federal law ties many vaccine mandates and reimbursements to ACIP's official rulings. Kennedy insists his overhaul is about transparency, not ideology. Americans won't trust vaccines until they trust the people making the recommendations, he told lawmakers. Yet public health experts argue that ousting seasoned epidemiologists and immunologists for lesser-known figures will have the opposite effect, fueling doubt at a moment when childhood vaccination rates are already slipping. What happens next? The Senate is weighing a bipartisan review of Kennedy's actions, the fired ACIP members are speaking out, and major insurers are watching closely. Meanwhile, physicians must decide whose guidance to follow when the next round of immunizations comes due. For 60 years, the ACIP's work has been largely invisible to the public. Quiet meetings, data-heavy presentations, and consensus votes that rarely made headlines. Now, that low-profile process is a national flashpoint. Whether Kennedy's gamble restores faith or unravels it will become clear soon enough, likely measured not in political points, but in vaccination rates, and ultimately in cases of preventable disease. We will keep tracking this story.